Today I'd like to introduce you to our subspecialty faculty. These are the faculty that residents will round with and work with. Most of them are the coordinators of the rotations that the residents will rotate on, and a few of them are my subspecialty consultants who help me plan the curriculum for the residency.
My name is Zamir Gill. I'm the medical director for palliative care. When residents rotate with the palliative care team, we help them understand and learn how to have efficient communication techniques with patients with advanced illnesses. We help teach them advanced symptom management, whether it be pain management, anxiety and depression, or other symptoms that can occur when you have an advanced illness such as cancer. The medical staff here in this region are extremely supportive of residents and education and are very collegial and always want to try and help each other out. This is a great place to learn. You have a lot of amenities in the area. Atlanta is not that far away from here. You have beautiful scenery around us, so you have a lot of things that you can do in your free time while also understanding that the community in the hospital is really trying to help you learn as much as you can before you leave.
Yes, my name is Jawad Ilyas, and I'm a gastroenterologist and a transplant hepatologist. I'm a managing partner with Atlanta GI Associates, and I'm one of the faculty members for the GI/internal medicine faculty for this program. So over the past several years, our therapeutic options for chronic liver and GI diseases have tremendously expanded. About 5 years ago, we started giving patients treatments for chronic hepatitis C, which result in a permanent cure. So that's one exciting area of chronic liver disease management. In addition to that, we manage a lot of patients with chronic inflammatory bowel diseases like Crohn's disease and ulcerative colitis. And every day our therapeutic armamentarium for those drugs is increasing. We're transitioning from currently injectable therapies to hopefully all oral therapies in the future. This is a very well-rounded rotation for our internal medicine residents. The first and second years mostly rotate with us on the inpatient service, where they're exposed to basically the entire length and breadth of GI and hepatology. They will see, regular routine cases for acute dysphagia to peptic ulcer and lower GI bleeds. We see a lot of patients with acute and chronic liver disease in this hospital. At the same time, we also see a lot of patients with acute and chronic pancreatic disease. So it's a very well-rounded rotation for our internal medicine residents.
My name is Dr. Nima Ghasemzadeh. I'm one of the interventional cardiologists with the Heart Center of Northeast Georgia Medical Center. I'm also the CCU director of the Northeast Georgia Medical Center at Gainesville campus, and in partnership with the residency program, we have been forming a CCU curriculum for internal medicine residents who rotate through our CCU. We have probably the largest, or one of the largest, as far as volume of patients with heart attack who present to the hospital that are being taken care of at Northeast Georgia Medical Center, Gainesville and Brazelton. So we have a very busy clinical practice. We take care of a wide variety of pathologies with respect to cardiovascular disease, and we have a very robust, cutting-edge clinical research program at Northeast Georgia Medical Center. So the residents can participate through the spectrum of the pathology, stable, unstable, and very sick population. We have all those pathologies here.
I've been here almost 30 years in Gainesville. I'm a cardiologist here. Helped to get the open heart surgery off the ground, and I was involved in the GME committee as the co-chair of the board investigation to kind of form GME here. So I've been involved for quite a while in the program. We have quaternary and tertiary care procedures that are being done, including mitral valve clip procedures, transcatheter aortic valve replacement, ECMO, which is an extracorporeal membrane oxygenation for people who fail to do well on ventilators. Their blood is circulated for oxygenation, as in open heart surgery. And other quaternary care, tertiary care type of procedures are being done. So it's, I think we have a lot of things going for us. Well, I think we have some advantages over established programs in that we're a new program, so we're not bound to some of the traditions that may or may not be relevant for the 21st century. We can kind of be open to creating newer ways of learning and different relationships that might benefit the resident. I think our location is a good advantage as well because we're on the outskirts of the Atlanta exurbs. We see a lot of patients from Western Carolina and North Georgia as well as South Carolina. And a lot of interesting cases, patients come in that way, where if you're in Atlanta, there might be a more limited selection perhaps. We have newer facilities and we're building more facilities for the physicians. I think the opportunity to participate in clinics and taking care of patients that are underserved is a good opportunity here. We think that is one of the benefits of having a residency program, and that they can have clinics that serve underinsured or uninsured population, and also to assist in care of complicated patients.
My name's Brent Flickinger. I'm a rheumatologist. I've been in Gainesville for 13 years, and I'm a coordinator for the rheumatology subspecialty clerkship. We treat primarily inflammatory arthritis and autoimmune disease. Rheumatoid arthritis is probably the most common disease that we see every day. Psoriatic arthritis and spondyloarthritis, lupus, connective tissue disease, vasculitis of all forms. We seem to have a lot of GPA and NPA in this area for some reason. We will do some regional pain syndromes, office orthopedic type of things, usually in our existing connective tissue disease patients.
My name is Sharaj Jacob, and I've been a practicing gastroenterologist for the last 25 years. I practice mainly at Gastroenterology Associates, which is a private practice in Gainesville. I also work at Northeast Georgia Medical Center, which is where I'll be training internal medicine residents. Residents are always welcome to learn about private practice by coming to our office. Medicine is in an exciting time at this time, especially in Northeast Georgia, as we are expanding our medical training, research, and scholarly activities. The faculty here are dedicated and are eager to work with residents as they accomplish their education goals and future career plans. When they come to our office, they can see the vast majority of gastroenterology conditions, including common reflux and advanced inflammatory bowel disease patients with complications. In our office, we have our endoscopy suite, we have our infusion center, we have FibroScan, where we can scan the liver for fibrosis. Those are the opportunities that these residents can get when they come to our office.
So my name is Deepak Agarwal. I'm a practicing nephrologist at Northeast Georgia Medical Center and also Kidney Care Center of Georgia. I graduated from Emory University School of Medicine and actually did all my training at Emory. I've been in Georgia for almost 30 years. And I'm the program director or program coordinator for nephrology rotation in the internal medicine department. And we are actually trying to recruit from these universities around us. At one point, half of the medical staff here used to be from Emory. So the physicians here or the practitioners here are very skilled. So I think we are trying to grow this program so the patients do not have to travel and they can get the same kind of care at Northeast Georgia. As our trauma services have grown, our critical care and what we are doing with the Heart Center, including offering LVAD, nephrology is very key. And because some of these patients, they're very challenging, and we are hardly sending these patients to other centers. We are able to take care of them here, providing renal replacement therapy. When I went through my residency, I was not exposed to the dialysis world. And sometimes residents get a very skewed impression of nephrology, and they think most of the patients are non-compliant. And usually amazed to see that 80 or 90% of our patient population in the dialysis, they never see much of the hospital. That they're full functioning individuals, they have full-time job, they travel, but even then they do dialysis. So we made sure that we designed the rotation so they have exposure to all those three areas.
My name is Dr. Adi Gopala. I'm one of the non-invasive cardiologists with multimodality imaging experience and expertise at the Heart Center of Northeast Georgia Medical Center. I work closely with the residents. I actually closely work with ACC. I work with them as a senior editorial consultant, where we review the cases and publish them. So with that knowledge, I work with the residents here and help them identify a case that is publishable and help them to get to a point where it is publishable. So we have so far done several case reports with the residents here.
Well, I'm Dr. Charles Nash. I'm the Medical Director of Oncology Services at Northeast Georgia Medical Center. And my role for the residency program is to give a specialty rotation in hematology and oncology. With that, we have been extremely happy with the quality of our residents we've been able to bring through our program over the past 2 years. We provide them with a tremendous experience in hematology and oncology. We see a breadth of different types of cancers and go into very great detail with them about the options available for treatments. We have a multimodal tumor conference every Wednesday morning where all specialties are represented: radiation oncology, medical oncology, surgical oncology, supportive care, clinical research. We have so we present the resident with a great exposure to lots of different opportunities to both investigate, to diagnose, and to help begin planned treatments for various types of cancers.
So my name is Andrew Johnson. I'm one of the faculty in hematology and oncology. I work over at the Longstreet Cancer Center, and I'm originally from Gainesville. So born in the area. My father was a physician in town, and they basically moved to the Gainesville area in the early 80s, and I was born over at Northeast Georgia Medical Center. So some of the cutting edge things that we do, specifically in the oncology department, I think, and in particular for residents in internal medicine to see, include both clinical trials for oncology patients that look at novel therapeutic agents that they may not necessarily see as standard of care options, but also we do something called a next generation sequencing, where you'll take the tumor and you'll look at it on a DNA and RNA based level and look for gene mutations that are altered, and as a driver mutation you may be able to target specifically with the drug, which is what we refer to as precision oncology. It's rare to find in most patients, but it's something that we look for and something that is great for residents in internal medicine to get exposure to. Being in Northeast Georgia, there's a lot of other opportunities outside of medicine to enjoy. You're not far from the mountains, you're not far from the lake, and so there's other fun stuff to do outside of the hospital.
So my name is Dr. Rami Arfoush. I'm a pulmonologist, critical care specialist, and sleep medicine physician. I'm an associate clinical professor of medicine with Medical College of Georgia / Augusta University Partnership. I am also, I serve as the medical director for the respiratory department at Northeast Georgia Healthcare System, and I am a faculty with NGHS Internal Medicine Residency Program, and I'm in charge of preparing the pulmonary curriculum and the pulmonary rotation for the internal medicine residents rotating through our internal medicine residency program. There are so many amazing and cutting-edge technology available for pulmonary patients at Northeast Georgia, whether that's endobronchial ultrasound, navigational bronchoscopy, in addition to other different interventional pulmonology procedures to help diagnose and manage cancer at the earliest stage possible. So residents rotating in the pulmonary rotation at the internal medicine residency will learn a lot of things. They will learn how to manage complicated COPD and emphysema cases. They will learn how to care for complicated bronchiectasis and difficult to control asthma cases and apply the newest medications, including the new biologic medication that we use in these conditions. They will learn how to apply state-of-the-art diagnostic workup and treatment for pulmonary fibrosis and pulmonary hypertension. They will learn how to properly screen for lung cancer and apply appropriate and proper early diagnostics and to identify cancer early on. They will, this is of course in addition to all kind of common respiratory pulmonary conditions and even the most rare pathology. I'm very confident the pulmonary rotation will provide an extensive exposure to all kind of conditions that any residents may encounter when they're caring for their patient at our residency program.
Well, I'm a general neurologist, so they will see all types of conditions related to any type of neurological disorder, including frequently Parkinson's disease, all different headache types like migraines and tension headaches, and even more atypical type headaches like trigeminal neuralgia, multiple sclerosis, Parkinson's disease and movement disorders. We have a lot of patients with Alzheimer's and dementia, many cases of peripheral neuropathy and neuropathic type processes. So really they get a wide variety of general neurology experience. Well, right now we have a new stroke director who's implementing an interventional stroke, which is very cutting edge. There's only about 3 or 4 centers in the entire state that do this. And that will be starting up within the next month or so. And I think primarily that's the most cutting edge, exciting thing that we have going on right now. That's primarily for the inpatient side, but it will help revolutionize how we treat strokes, because most of those patients in the past had to be transferred out.
Yes, so we're glad you're watching all of our videos. Make sure that you watch everything that's on the invited checklist of videos. It's important to have a complete understanding of our program. After you've watched all the videos, it's important to fill out the forms that are for all the invited interviewees to complete. So be sure to check out the form section and make sure you're completing all of those prior to your interviews so that we have the most information about you and we can have the best possible interview. So if you have questions, we have a email address that you can email. It's our internal medicine coordinator at nghs.com, and we can get all of your interview questions addressed through that email.